And right now, we're going inside your schools tonight, where there's a shortage of one of the most essential positions. There's a shortage of speech-language pathologists across the country and right here in Minnesota. Ellen Gallus is live at the University of Minnesota, where they're trying to fix this problem. Ellen.
Well, Lindsay, just why are speech-language pathologists so important? Well, consider this. According to the National Institutes of Health, 1 in 14 kids was diagnosed with a communication disorder last year. Now, here at the University of Minnesota, they're trying to come up with creative, proactive solutions. Yes! 8-year-old Everett Wyke spent the first years of his life nonverbal, unable even to swallow. His mom says therapy with a speech-language pathologist, also known as an SLP, has changed that.
It's really improved his quality of life. Is it hard when people don't always understand what you're trying to say?
Everett's been in therapy since a baby, and he sees an SLP every week at his public elementary school in Plymouth. But there's a shortage of SLPs here in Minnesota.
There's districts still within the state of Minnesota that do have open positions for speech-language pathologists.
Emily Ost is the president of the Minnesota Speech-Language Hearing Association. She says one of the reasons for the shortage is that there are not enough new graduates in the profession to keep up with job openings. Also, more kids are being diagnosed with communication disorders. How come?
With early identification, we're better at identifying students and children's needs.
At the University of Minnesota, they're working to get ahead of the shortage.
We're also trying to think of other ways to get people services.
Becky Ludwig-Luley is the director of clinical programs in speech-language pathology at the U. She says they're launching telehealth programs in 2 different rural Minnesota school districts. And they've structured their program to get more graduate students out in the schools to help SLPs with caseloads.
We have 30 students that each get 3 external rotations during their program.
After all, communication is an essential foundation in school, and students like Everett just keep building on it.
I want him to be able to just live his life and be understood and be able to participate. I can't imagine how frustrating and sad it would be if he wasn't able to get the services that he is getting.
Now, there are options for families who have challenges getting served by their school district. Some of them opt to see a therapist in private practice, which may or may not be covered by insurance. Also, many universities, like here at the U of M, have training clinics where you can get services at a reduced rate. Reporting live at the U of M, Ellen Gallus, 5 Eyewitness News.